Great. And you can start whenever you like.
Awesome. Thank you. Thanks, everybody. Super excited to virtually be attending today and being able to share this project. So I'm going to keep an eye on the time because my screen is just my presentation. So I'm going to share a project that Julia, my grad student, PhD student, shared a piece of yesterday, which is centered on co-designing accessible sport and recreation and leisure opportunities in rural and remote areas of New Brunswick. My name is Jackie Oncescu. I'm the lead researcher, and I'm presenting this work on behalf of our team. This is our team. So we are a group of researchers, designers, and equity-owed citizens that have been funded by the New Brunswick Economic Social Inclusion Corporation, UMB, my research program, and the Sport and Rec branch at the province. So it's important to me that everybody is introduced to our residents here. They are, we have top left, we have Tanya, and then second to the right in the top is Corey. My top right, I think your top right, is Kyle. Below Kyle is Colleen. Below Colleen is Hope. And Kathy is in the middle row on the left. These are, to me, some of the most important people in this project as residents with lived experience, with experiences of poverty in particular, with and amongst other identities that they hold. So this is our team, including our designers that are in there as well. So here's the purpose of our group coming together was to work collaboratively to reimagine access for sport, rec, and leisure. So we use the acronym SRL for equity-owed residents of communities across New Brunswick and rural regions. So the goal was really to figure out different ways of effectively supporting citizens that predominantly live with low incomes that have multiple axes of oppression. How do they experience sport, rec, and leisure, and how do we create better access and more participation? So we work collaboratively across a couple of regions in New Brunswick. So this is New Brunswick, and we're working in RSC2, which is the top in the purple, which is predominantly a Francophone region. And then we're in the bottom in the Regional Service Commission number 10, which comes with a few islands. So not to complicate this project anymore, but we're in one end of the province to the other. Working with different groups, cultural groups. These regions were not selected by us. They were selected by the funders, and they picked them largely because they were rural and they understood that rural regions have different challenges to designing and sports, rec, and leisure. They wanted to be in the north and the south. This is a government-funded project, so they have to look politically I don't even know what the right word would be right now, but, spread out, and that they're honoring the French and the Anglophone communities as well. So those are important criteria for the locations that we were in. So we are 2 years into this project. I am not going to spend too much time on year one because I really want to talk about the co-design experiences that have come from our project. So in the first year of our project, we did some background research. We spent a large part of the year working in these two regions, identifying stakeholders that work in poverty reduction, interviewing, connecting, trying to understand the communities and the challenges that they face. Through the process, we're able to identify individuals that work closely with equity-owed residents. And through partnerships with these individuals, we were able to run workshops over the course of the year where we sat down with roughly 100 equity-owed residents to talk about what sport, rec, and leisure was like for them in their communities. We did some really cool mapping activities, some really cool tactile activities to collect some information and build some relationships. And then along the way, we've been doing knowledge mobilization and sharing what we're finding with practitioners as well. At the end of that year, we were able to identify and build relationships with 5 equity-owed residents that we met in these different workshops and invited them into doing a design process. So essentially what happened is we collected a series of information about what was accessible and not accessible and why around sport, rec, and leisure in different communities. We condensed it, analyzed the data, and then we had equity-owed residents go through a what we call a design process or design sprint. We had one community connector who was a school community coordinator who does have a lived experience of being equity owed and also working now. We took them through a design process that addressed the barriers and gave them the creative power and energy to design solutions to address the barriers in community. I'm going to spend time talking about what they designed. So after our 6-week design process, our citizens looked at all the data and all the barriers that they found and that we discussed. And at the end of the day, the citizens in the group said, you can design fee assistant programs and low cost free drop-in swimming lessons, but we don't feel that we belong. And until we get to do this work with practitioners, they're not going to understand the trauma and the oppression and the discrimination that we experience in our communities. So they propose what is called the system shifters. And the system shifters is a co-design experience where we collaborate with designing what we call community tactics, which are short-term pop-up experiences in community to address barriers to sport, rec, and leisure, but they are designed in a co-designed manner between providers or allied stakeholders, such as school community coordinators or librarians or community developers and residents with lived experience. The purpose of co-design was to create a collaborative environment to advocate for more inclusive and accessible sport, rec, and leisure opportunities for equity-owed residents and to address those barriers. But most importantly, what came out of the co-design experience from the residents' perspective is that they don't want access. They don't want just inclusion. They want to feel that they belong. And we need to do this in dignified ways. And so through the co-design process that we tested in year 2, which I'm sharing today, is we used community tactics. Let me see. I'm going to skip back for 1 second. We used community tactics, which were tangible short-term pop-up events or half-day experiences or activities as a testing ground for co-designing. And we co-designed with sense of belonging being the most important experience that they wanted out of these community tactics. Our residents told us that belonging kind of had 4 pillars. You need to be connected to people, and there would be, positive connections built within the experience, and you needed to feel welcomed. The access needed to be dignified, meaning that people needed to feel respected and there was no harm caused through accessing resources to participate. And then they needed to feel inclusion, and that inclusion measures were put in place so that people felt all abilities or experiences could be there. So we had a framework for what they felt sense of belonging was. We had an idea of what co-design would look like. And then we went through a process of planning with these community tactics. So these tactics, as I said, are concise and short-term initiatives. We kind of like mini experiments. And this is on the right-hand side is just kind of the process of our co-design that we did. But what we did is our 6 residents at year 1, we had 4 that continued into year 2, and they we had them select a barrier that they wanted to address in their community that we centered the community tactic on. And then we took each resident and invited sport rec providers in those regions or allied stakeholders, because we're in rural areas. There's all sorts of different professions that will do sport and rec kind of planning, to co-design based on what the resident felt was most important to address. So we had 4 community tactics that went through this process. And I can't spend a lot of time on that process, but I do want to share with you what each tactic looked like and who was involved. So we were in Heron Bay, Utpaganjik region, which is in the north. And we have an elder on our community, in our committee. We talked a little bit about this yesterday with Julia's presentation. The tactic was focused on elders not feeling that they belonged in the local recreation center. So we organized a bus trip. That was the tactic. And we designed for belonging, and with the purpose of making connections between the rec staff and elders in that particular tactic. We had a tactic in the southern region, which was focused on outdoor play boxes. We Hope, who's originally from Nigeria, relocated to rural fishing village in New Brunswick, was concerned about access to outdoor recreation opportunities. So we launched a social event around a play box. And we had a YMCA director co-design with her, and it went really well. So we focused on getting access to equipment and facilitating some unstructured outdoor play as the tactic, like purpose. We also had a tactic where Corey was concerned about equity-owed residents not having access to participating and giving feedback on public recreation infrastructure. And so he wanted to evaluate the trails in the community and to give that opportunity or create a better opportunity for equity-owed residents to provide input. And he and our team co-designed that with the rec director and the town clerk. And then the last one was a social skate night with a school community coordinator, there was a family skate night event that the school used to hold, and the school has a lot of families that would identify as equity owed. Skating and lessons and learning to skate, there's several barriers, so that was the focus of the tactic. In this particular tactic, we did not have we invited the municipal recreation director to co-design, and they did not co-design with us. They didn't respond. So we ended up working with the school community coordinator and doing the event as we went on our own without them. So we did a lot of data collection following principles of community participatory action research and using human-centered design. We evaluated we wanted to know how participants experienced all of these. So we did some like program evaluation type surveys. And then we've done interviews with our residents and the providers that did the co-design. And then we have participant observations and journey maps from our team, and endless and oodles amounts of team meeting notes and recordings. So how did this co-design impact providers and residents? I'm mindful of my time, so I might need someone to tell me if I go over, but providers talked a lot about how working side by side with residents, it opened up their eyes to the diversity in their community. It built it fostered relationship building with residents that they often struggle to reach. They talked about empathy and how they better understand experiences of residents living in poverty and low income, or as a newcomer or as an elder. It was really great to hear practitioners talk about the increase in their confidence in doing design for belonging and inclusion and access. They felt they had a little bit more confidence doing the work collaboratively. It challenged stereotypes and ideas and judgments that practitioners had of equity-owed residents, which was good to hear. And it increased their awareness of the challenges that residents are facing living in their communities. Our residents shared quite a bit. It was really cool to hear what they had to say. So increased cultural understanding. We have a lot of learning in our team meetings, learning from, Hope's experience as a newcomer into the community, from Colleen as an elder. So there's lots of cultural learning that happened for residents. Increased access to social capital and relationships. One of our participants had talked about how they now have all these providers that they can call up and ask for help now that they've been doing this work. Increased skill development and planning and promotion, doing the work side by side with practitioners. residents felt respected and valued, and that they had purpose in the community. One talked about feeling empowered, and sense of belonging that came from working in a project as well. But what's really cool about this project is we looked at the data and our experiences with the tactics that had providers co-designing and tactics that did not. So we have 4 tactics, and we had one tactic with no provider at all, one tactic where the provider was kind of in and out and not there fully immersed, and then the other 2, the practitioners co-designed from start to finish. With the providers start to finish, it worked really well. Providers were hands-on, supportive, and more encouraging. They were available for weekly meetings, face-to-face, consistent communication. The responsibilities were shared between resident, provider, and the other stakeholders involved, including our team. We took on some roles. The providers that were committed were reliable and consistent. Their approach was accommodating, flexible, and supportive and encouraging. And the providers that were involved from start to finish made the residents feel valued, and they did this through their support. They respected the resident, listened, heard, understood, and connected, and it created an overall experience that we call being relational. The provider, the tactic with no provider, and the tactic with providers that were kind of in and out, they were hands off. There's limited contact or email communication only, disengaged or completely disconnected. Responsibilities were then offloaded to residents or other stakeholders involved. The commitment from the providers was more unreliable. We even had groups of volunteers from a local sport community that were going to volunteer for our skate night, and they canceled the night before. So commitment was unreliable. The approach was really closed off, challenging to reach, not accommodating, and not even helpful for some of these events, or for one of the tactics. The result for the residents that were part of the tactics that were where the provider was not there, the word burden and feeling like they were a bother and that the event was a bother was what came forward in the research, which ultimately didn't make them feel valued. And what we found with this approach to co-designing, popping in, popping out, not really being there for the relational work, is that everything ended up being transactional. And that doesn't create belonging. We have a lot to share and there's not enough time, but where we're at with this project and what we're seeing in terms of co-design and why it matters is that when we saw the practitioners and the residents building relationships to collaborate, I see a hand up, so I think I'm running out of time, is cultural relevancy. So there's a stronger capacity for actually creating efficient and supportive provisions that support belonging and participation. It increases representation of equity of groups. Decision-making improves because the process is bottom-up, supported by people in community with the mandate to provide sport and rec. So the decision-making improves. Relationship building, it bridges relationships between groups of people that often struggle to reach and meet each other. There is shared power. Equity residents have power to inform the particular tactic and what got implemented and how. And it fosters community capacity to address social change, which is really important for social action. I will end it there and stop sharing my screen.